And I believe now we are going to be turning it over to some Q&A.
All right. And hopefully not a lot of that was new to everybody in this room, but in case it was, it's always good to start out at least with an introductory level when it's something that can be as complicated as this will be, at least for us. Now, we want to get right into Q&A. Hopefully at least one of you has a question. So raise your hand. I'm going to be walking a mic around. We're also going to be getting them, and we've probably been getting them on the webinar. And pretty much let's get started. But just a reminder, this is something that the coalition has been working very hard to bring together. This is now our third webinar on Sunshine, and we're hoping to have the full support of the membership with the coalition. There'll be a meeting tomorrow to get volunteers to help us do initiatives like this. Damon in the back of the room will have membership forms for the coalition itself. You guys know who Damon is. So with that, raise your hand if you got a question. All right.
Some audio here. Would you please give your name and organization when asking your question? Thank you very much.
Yes, I will. My name is Kate Sheridan. I'm with the American Society of Hypertension. And thank you, Anita. That was really a great, very succinct presentation. I have a couple of parts to my question. Number one, I get asked by my physician committee members and our just general physician faculty members all the time if I could briefly summarize what this means to them. So I'm wondering if that presentation is available on the CMS website.
We're going to have that available in the Harvester, actually, pretty much right after this conference, and then or not the conference, but this meeting, and then once it gets updated through the app. So the slides will be available to everybody.
Okay, great, thank you. And then the second part of my question is a brief hypothetical. We're an accredited CME provider. We provide education that's not accredited. We recruit physicians and receive industry support for this education. Am I correct in thinking that that comes under the third-party payment definition that you just described?
Anita, do you want to respond to that one? We still have Anita.
So it sounds, hi, yes. So it sounds like you're describing a situation where industry would pay you as a convener of continuing education, and then you make the payment to the physician, correct?
Anita, in this instance, it is not a certified activity. So I'm thinking indirect transfer value, but please correct me if that's wrong.
So it does, if the payment is being made by an intermediary, i.e. a CE sponsor, then yes, that sounds to me as well like an indirect payment. If it's not subject to the exclusion, it would be reportable.
So because you're not actually certifying your activity, it does not comply with all three of the exemption criterion, regardless of whether or not you are accredited in this instance. So that would be reportable. One more. Okay.
Just one more question to that. So that means that the company would post the payment, the transfer per the protocol that you just outlined. And if we, as an accredited provider, recruited the physicians, the onus would be on the physician to make sure that if we made the payment to them, that they would check and make sure that it was correct?
Anita, I'm going to let you handle this one, but the question is about essentially whose onus is it to verify the information in an instance of indirect transfer of value?
Okay, so we're having a little bit of dialogue here. So the physician, in terms of the onus and who has what responsibility, the manufacturer, the industry who made the payment to you that then went to the physician, they are the ones that are subject to reporting, so they would report that data to CMS. The physicians are then voluntarily engaged in the program to review their information and dispute anything they feel is inaccurate. And so they would need to understand and associate that payment with your event. And so in the way that you guys design processes to inform the physician about the source of the funding, I assume that would be incumbent upon you all, but the physicians themselves have no onus to report information or any responsibility to do anything. It's a voluntary engagement on their part.
That's perfectly clear. One important note for basically everybody in this room, and the processes that Anita's referring to in this instance, that's the tracking portion, so that it's not something where you're given a bunch of money and you divvy it out, essentially. Industry's not going to know who received what part, but they're going to ask you because they're the ones who are going to have to report it. And it comes into those specific systems. Who else has a question? Oh, one, and then back. Oh, Ann, come. Say your name.
Ann Groupie, American Society of Clinical Oncology. One piece that we would love to be able to communicate out to our members is what the data, how the data is going to be displayed and communicated to the general public. We have a good sense of the data that needs to be collected and reported, but physicians aren't quite sure. Is it just going to be the company? Is the relationship and the transaction going to be put into context?
Thank you, Ann.
So the rule itself does provide some specific requirements for how what we display, what we can't display, and what the high-level features and functions of the website must include. So there are some data points that are reported to CMS, which we are not allowed by law to the website. And so those specific data points are outlined in the rule around, for example, the name and address, the company, the date, the amount, the nature of payment, things like that will be made public. The rule also requires that we make the information searchable, downloadable, and aggregatable. So the ability for someone to download the information will be there, the ability for them to aggregate, and we will aggregate some data points already, so those features and functions will be present. The other thing that I would mention is that from a physician's perspective, or I guess from a consumer's perspective, they will be looking at the information for a myriad of reasons. And so CMS will make the information available so that they can use the data in the ways that they need. They will be able to identify specific physicians. They will be able to look at information in different ways, and researchers will be able to, of course, download the file and apply some more sophisticated analytics to that information as they need. But the consumers are the focus of the transparency program, and they will be able to see all the data elements that we are able to make public on the website.
Thank you, Anita. Bryn has, I think, a question from our web respondents.
Yes, I do. A couple of questions. I will just aggregate a couple of them because a number of folks on the webinar are asking about teaching hospitals. Teaching hospitals are mentioned continually. What about non-teaching hospitals? If we are a teaching hospital, does the CME exemption still apply, or is everything reportable because we are a teaching hospital? And we are a non-teaching hospital accredited by the ACEhp. We already look for conflicts of interest, receive grants from pharmaceutical manufacturers, and use the money for CME conferences.
Bryn, can I stop you there? Because that's
Sure.
about a 5-point question at this. So I think the first part, Anita, is if a teaching hospital is accredited by the ACEhp and putting on a CME certified activity that complies with all 3 exemption criterion, do they still have to report simply because they're a teaching hospital on that list? And I assume they're thinking about that right now.
Anita, we just want to make sure you know that question is for you.
Yes.
Nope.
Thank you.
For those of you who were in the opening session, we don't have the Jeopardy music available, but feel free to hum along.
So one important clarification in the question itself was teaching hospitals needing to report the event. And so we just want to make sure we're clear that the teaching hospital isn't reporting any information. It would be the industry. So we wanted to make sure that that was clear because that was a concern as stated in the question.
That's actually a good clarification, and so I guess we should restate it as if they're receiving support for a CME certified activity that is following the exemption criterion, does industry who gave them the support still report on this transfer of value even though it follows the exemption criterion, because they are a teaching hospital.
Yeah, I think we'll probably need to maybe take that offline and think about that and respond back in a different way.
Can I ask a question then rephrased in another way, Anita, that may or may not help, and feel free to say you still need to take it offline?
Sure.
Because the teaching hospital itself is the covered recipient and all of the exemption criterion in this hypothetical are being followed, would it not then be exempt? Or you still want to take it offline?
Yeah, so I mean, I think that the payment or transfer of value generally would be reportable, but
Okay.
I think that we can come back with some more specifics.
Thank you. And Bryn, did you have another 9 of the points in that question that we can?
I have many questions. Many. There are lots of busy folks that are on the webinar right now. I would like to tell the folks on the webinar that a number of your questions I think we will be able to address with you separately to offer some information based on CMS regulations that are already out there. So if we don't get to your question, then please bear with us, and we will try as we finish up the annual conference to get back to you and offer you some guidance that we can give. Do you want to take another question?
Yeah. Is there somebody else?
Thank you.
Oh, yes.
I've heard a question raised, and I'm told that it's been commonly acknowledged as a problem, but I haven't heard anything about it. Assuming a provider meets all the criteria for an activity for exemption, and normally programs are by MDs for MD audiences, but in a situation where the audience is multidiscipline, including like pharmacists or nurses, I've been told that there's an issue about perhaps having to report it because it's cross-specialty.
In this select instance, Anita, there's a couple of ways that this could be addressed. I think the pertinent question is if there are, say, physicians who are receiving honoraria teaching to pharmacists, essentially, and the physician who is a speaker is receiving that honoraria, even though it's not designed for physicians in the course, and he's getting that money essentially as an indirect transfer of value through industry, is that still reportable?
Yeah, basically.
I can restate that probably a little clearer if you would like.
Yeah, so maybe that would help. I mean, the way that I'm sort of hearing the question, if all 3 of the exemption criteria are met, and the physician and the speaker is a covered recipient, then it's not reportable if it meets the exemption. Audience members, there are particular aspects of transfer of value associated with the event that are still reportable, even if the exemption applies, but their tuition fees, for example, and educational materials would not be reportable. So there is the discerning factors between being a speaker versus being in the audience. If you have audience members that are not covered recipients, then this doesn't apply to them anyway. Whether they're a nurse or a PA or whatever the examples were, they're not covered recipients for the program.
So Anita, I didn't ask you that part of the question because that's the easy part. The question is for when a covered recipient is speaking to non-covered recipients, so it would not be certified under one of those exemption criterion. It's just getting clarification that if the activity is commercially supported, so an applicable manufacturer is providing funds to an organization who is educating nurses, and those funds are in part used to pay honoraria for an MD to speak to those nurses. That transfer of value indirectly from the applicable manufacturer to the covered recipient speaker MD is reportable. Yes?
Yes, correct.
There we go. John, did that answer your question?
Is it understood that the nurse, the PA, or the pharmacist would also get credit? It's an accredited, not a promotional activity.
Yeah, it would be accredited, but because their standard is not one of the 5 that was listed under the exemption criterion, Anita, correct me if I'm wrong, but because it's not under those standards, it doesn't comply with the exemption criterion, and therefore that speaker, not exempt.
Correct.
All right. We got another one. All right. Bryn, do you have any?
Yeah, let me jump in here for a moment. There is we have a webinar participant who's wondering, how do you handle when a commercial supporter is asking you to sign a document regarding the Sunshine Act, even though the activity is ACCME approved and all 3 criteria are met? They would like an attendee list and the amount of food costs per person at the activity, even though it does meet that criteria. Do you have any guidance for that?
Anita, I'm not sure, and let me kind of assist with the asking of this question. In this instance, it's where an applicable manufacturer is requesting information about who would be covered recipients, but the activity complies with the exemption criterion. So the part of the how do we deal with that is not as much a CMS question. That's something that we can either take offline or that other providers are going to have to help you with. But the component essentially is what happens, Anita, if that list is still submit as if it wasn't exempted? Again, I can restate that if you need.
Yeah, so you're correct in your answer in terms of we wouldn't be involved or in an appropriate position to provide guidance or any requirements about whether the organization is required to give information to the funder of the activity if it's an exempted one. If that data was submitted to CMS in error, because if it is an exempted activity and then they submit that to us, we would receive that information and assume it wasn't part of an exclusion. So we wouldn't have any way to know that that event should not have been reported. And at that point, it would be important for the physicians to be involved and engaged in our process so that they could see that event and raise that question and hopefully get that erroneous information removed from our system by the manufacturer.
So is this another reason why it's important for the physicians who are covered recipients to be reviewing that kind of data? And could you go over what the appeals process for something like that, which was erroneously added, would be like?
Yes, you're absolutely right. It is critically important in our mind for physicians and teaching hospitals to be aware of the program, to be tracking their own transfers of value throughout the year so they have an accurate account against which they can assess the information submitted about them. We have released several tools to actually help perpetuate that tracking. There's some mobile applications that have been released available to Android and iPhone users that physicians can use voluntarily on their own device to actually track those transfers of value as they occur during the year. Or, of course, they could use any other tracking mechanism that they desire. So, yes, we do want physicians and teaching hospitals to be doing their own tracking, and then the information will be submitted to us by industry, and then the physicians can voluntarily, and teaching hospitals can voluntarily come in and review that information. So you said the word appeals, and I'll correct in that it's not an appeal process at this point, it's a dispute process. Okay. So the physicians that voluntarily choose to come in and get involved with our open payment system will be presented all the data that we have that was reported about them across industry. They can then choose to take no action on the information they're seeing, or they can choose to dispute particular transactions. If they do dispute the transaction, we will route that dispute over to the manufacturer who submitted that particular piece of information. The resolution process is then an external process to CMS. It is between the industry and the physician to get together to talk about that issue, to come to some sort of a resolution, and then the industry representative would come into our system and update that particular transaction, and we would remove the dispute flag at that point. So that's the ideal situation that we see, that where a physician that disputed something, it does get resolved by the industry. In situations, however, where we are not able, or the industry is not able to resolve the dispute and the data is still disputed in our system, we are still required to make that information public. However, we will mark it as disputed on the public website.
Thank you very much, Anita. And we have a clarification that's going to take us to the third rail of this issue.
Hi, Anita. This is Pam Mason from AstraZeneca. Part of that question had to do with asking for a list of the participants because it sounded as if there was a meal or food attached to that particular educational grant. Can you provide some clarification to the participants here about whether that would be reportable or not?
Yeah, so for this, and there's a distinction of importance about the speaker and the attendees. So for the speaker, if it meets the criteria of the exclusion, nothing is reported. But if it is an attendee, a physician-covered recipient attendee, then yes, the meals and other transfers of value like travel and lodging being paid for, those sorts of things are still reportable. But the tuition fees and educational materials that they're given at those events are not reportable.
Thank you, Nia. That was very well said. And we've got another question here from our audience.
Hi, this is Susan Whiteman from Washington University. We have had two speakers over the last couple of years who are experts in their fields, who when we asked them to do a presentation, they referred us to a consultant company where all their fees come out of for travel, etc. So we were asked to reimburse the consultant company as opposed to the physician. What about that?
So, Anita, I guess the clarification there is in the case of an indirect transfer of value to a physician who routes it to a third party? Okay.
Okay, so the payment is going from the industry to a intermediary company and then to the physician, correct?
Not exactly. It's going, say, from industry to a CME provider, but let's say at first it's not certified for credit. So it's going to go from an applicable manufacturer to a hosting of the educational event organization. And instead of going to the covered recipient, it's going to go to a third party designated by that covered recipient.
Right, so that is a third-party payment. So if the physician directed the payment to go to wherever entity, then that's a third-party payment, and it is reported under the name of the physician.
Okay. And in the event that the activity that this was taking place at did follow all of the exemption criterion, then it isn't reportable in that instance for this speaker.
That's correct.
Thank you. All right. Bryn, do you have any more from our...
Excuse me. I do have quite a few questions here. I will say that a number of them we can follow up with, and we will follow up with you all. There are some questions about if all three requirements are met, is there still an issue between plated and buffet meals, and does charging a registration fee that covers the cost of a meal negate this reporting? I bring this up because we have a lot of questions about meals still. It seems to be the
third rail issue. So, Anita, I guess the clarification is following what was a somewhat listed exemption in the final rule surrounding buffet meals at large-scale events, and we understand large is still not defined. Is that then exempted when the rest of the conference would be?
So I would suggest sort of separating out the data points of the situation. I mean, if it is an exempted event, altogether, sort of what are the conditions, and then if it is a large-scale event where there's a buffet meal, so you're correct in that the rule does not define large-scale, and so what we are providing by way of guidance is for the manufacturer to ascertain the applicability of large-scale events and to provide clarification about their rationale. For example, in their assumptions documents they submit with their reporting as to what their methodology was for discerning large-scale and things of that nature.
So the question still lingers of if at a CME certified activity that is following all three exemption criterion, if a buffet meal is served, is that transfer of value seen as reportable?
Right, so again, if it's an excluded event, then the physician, nothing is reported about the speaker themselves, so their meal, whether it's buffet or not, would not be subject to reporting. For the physician-covered recipient attendees, again, it gets to the point of whether or not it was a large-scale event that manufacturer consistently and can justifiably consider a large-scale event with the buffet service. So if that is part of their rationale that they can justify why they considered it to be exempted due to the large-scale event exemption, then that would be a case-by-case basis that each manufacturer would have to assess independently.
So this goes back to the August 8th webinar from CMS, where it was basically the answer of if you can figure it out, then it needs to be reported. That was a question.
Yes, that's correct.
All right. Do we have another question here? Oh, there we go. Say your name and name and location.
So I'd like to ask a follow-up question to this gentleman's question in the front about an event where the attendees were nurses or other non-physicians. So if the event is accredited by ACEhp for physicians, and it's also accredited for nurses, for podiatrists, for PAs, for NPs, is all of it exempt because it meets the criteria for physician exemption?
So Anita, as far as clarifying this, if there are multiple forms of accreditation or certification applied to a single live activity, and one of those forms complies with all of the exemption criterion, it is then exempted, yes?
Yes, that's correct.
Okay. Now,
and the other thing to clarify to the gentleman's question, specifically to attendees that were nurses or other specialties that are not covered recipients, they are, they're not reportable in any situation because they're not covered recipients.
thank you very much. Do we have anybody else who wants to? Oh, in the back.
Hi, Heidi Keeler from UNMC, University of Nebraska Medical Center. And this is a follow-up to this line of questioning. The question has been asked of you if the event meets the exemption criteria, are nurses exempt as well? But my question is, for those that are not covered in the 5 umbrella organizations, what does the future hold for those? If it is I'm asking this because many of the nurse practitioners, they are educated by physicians, and so by not being exempt, those physicians may not choose to educate a target audience made up primarily of nurses or other quote-unquote unaccredited organizations. Could you clarify that?
So Anita, I think there's clarification needed on the question to clarify other questions. Essentially, one point is when, at the earliest, will CMS be able to revisit which systems are under the exemption criterion? And let's start just there.
So the process, as you're all probably aware, for making updates to the regulation involves the rulemaking cycle. So any changes to this exclusion or any exclusion would need to go through the notice of proposed rulemaking, solicit public comment, and then go into final rule status, which typically, in my experience, is about 6 to 12 month process to sort of work through under typical circumstances. So that is the process that we would use to make any changes to something such as this item.
And with a 6 to 12 month process cycle, at the very earliest, and we will never hold you to this, when would the possibly earliest time be that that cycle would start? Are we going to wait until the first reporting of data before that's ever discussed, do you think?
Yeah, it's not something that we can address today. I do think that, there are areas of the rule that our team is aware could benefit from some updating, and so we are sort of identifying these items and working on a strategy for when we would open up rulemaking. But I do think that a lot of the potential edits and updates to the rule will also become apparent once we do have data and we are able to understand a bit more about the way that this is rolling out. So I do think that that would implement additional updates that we seek. I did want to also make the point with regards to the question or the circumstance where physicians may be reticent to participate in non-exempted activities, and this would not be a outcome that CMS would desire to see, and the program itself is not intended to draw conclusions that if your data is reported about you, that somehow is a bad thing. There's a lot of very positive transfers of value that will be on the site and that we hope physicians are proud of discussing with their patients. So we would like to see the message be not so much the fact that it was not an exempted event, but rather this data about you being a presenter at our event would be made public, but this is a transparency program of very good and positive interactions between industry and physicians. That is not, our program is not meant to sort of trend in the other direction.
As you were saying before, it's to disperse the data, not to interpret it, essentially, right?
Correct.
And just to clarify, and I know this was in the slides, but given the wording of that last question, please just clarify that, again, nurses and PAs are not covered recipients themselves, yes?
Correct. They're not.
Thank you. Bryn, we've got one over here.
While you're making the trek over, I'll just let you know that we have about 9 minutes left. So we do have to wrap up on time. Just want to kind of keep everybody on schedule, and I will throw in. Well, I'll let you ask your question first, there,
okay.
Derek.
Derek Warnick with D. Warnick Consulting. I apologize in advance. I have another question about meals.
Oh,
of course. I'm just hoping maybe you can let me know if this was interpreted correctly. So I had a recent situation where it was a CME activity, accredited for CME, 300 plus people in attendance, buffet meal, both the commercial supporters and were okay with the buffet meal, no reporting requirements. One individual, about a week before the conference, contacted the CME provider and said that they needed a kosher meal. So at this point, the CME provider now knows the individual requesting the meal, they know the cost of the meal, and so by their interpretation decided this is now reportable, let the physician know, it was a physician, sorry, let them know that I'm going to have to report this information, and they decided to decline the meal. So now they're in attendance at this conference. 300 of their colleagues are getting dinner. They cannot because of their meal requirements. Was that interpreted correctly?
That's an interesting question. Anita, what are your thoughts?
So the guidance is that if the parties that are involved and subject to reporting have information about the transfer of value necessary to have that item be reportable, and that they know the identity of the physician, they know the value, and they know the supporting details about the transfer of value, then it is subject to reporting. It's known data that is subject to the provisions of the regulation and would be reportable.
It's a very interesting contingency and series as it came down. But Bryn, you had comments before?
Excuse me. Fines levied on industry. Are fines levied on industry or physician providers?
Anita?
That's a great question. The civil monetary penalties for noncompliance to the regulation is with the industry. It is not with the physicians or the teaching hospitals. The teaching hospitals are not subject to any of the civil monetary penalties. Those are for specifically for applicable manufacturers and applicable group purchasing organizations only.
My name is Melissa Carter. I'm with the Florida Medical Association, and I was hoping that I could confirm that there's a clear agreement that state-accredited CME providers, so a CME provider accredited by any state medical association, would be equivalent to the nationally accredited provider, the ACCME accredited provider, in terms of that list of, so that you could be exempt.
Good question. All right, Anita, do you understand that one as it was worded?
I do understand it.
Okay.
And so the exemption, it is specific to those three particular facets of the exemption, including those 5 named organizations only.
So the question is specifically if a state is then providing the ability for somebody to issue CME credits in alignment with the ACCME, does that qualify under the 3 exemption points?
No, it does not.
I'm going to let Melissa follow up on this.
And so then my question then becomes, because the State Medical Association is recognized by the ACCME to accredit in their own state, and it's an equivalent process. So there's equivalency between state accredited providers and nationally accredited providers. So that's the issue, and that the ACCME has indicated to us that we are equivalent.
So does that make sense, Anita? Because the accreditation is not coming directly from the ACCME itself, it is not subject to, or it does not fall under that one of the, at least the 3 exemption criterion. Is that correct?
That is correct.
Folks, there are coalition membership forms in the back of the room here with Damon. And we've got probably time for only one more question here.
Yes, one more question, and if we run out of coalition membership forms, you can pick one up at the registration desk.
Hi, Anita. It's Tom Sullivan. Hey, just to clarify, the last question that was asked for the state provider, they give AMA CME credit. So it's an AMA program. So it falls, my interpretation is it would fall under one of the 5 organizations that's covered. In addition, the ACCME has accredited state organizations to accredit local programs, and that would also be counted as an ACCME program.
So again, just clarifying that same issue, Anita, can you speak to it with that very good articulation?
So it's very specific to if the event is certified by ACCME. And if it is, if it is, then it is exempted. If it's not, then it's not part of the exclusion. So ACCME being an example of the 5 noted areas. So it's very specific to that alignment of or that relationship, not a commensurate certification.
Okay. So, okay, I'm going to belabor this issue a little bit more, and Marissa's also clarifying with me here, because in this instance, the credit isn't issued from the ACCME for any of those organizations, and this goes back to the definition in the final rule itself of accredited and certified education. So in the final rule, I believe it defines accredited CME as being put on by an ACCME accredited organization. So it doesn't have to come out of the ACCME itself. The, I guess, clarifying point is when the ACCME has given a state medical organization the ability to certify another body to give AMA PRA Category 1 credits, that is not exempted?
I believe that does sound like it's exempted if it's an AMA event. It's an AMA accredited event, correct?
I think this is something that we're going to have to submit as a formal FAQ question, and that's going to need a little bit more review. We are at our time at this point, but that's a question that we will seek explicit clarification to. I want to thank Anita Greiner. Please, everybody applaud for this. Again, coalition forms are in the back. Thank you all for making the time for this today. It was wonderful to see the turnout. Anita, thank you very much, and have a wonderful afternoon.
Thank Thank you so much, everybody. Thanks for having us.
Yeah.